Assalamu alaikum. Since morning, I have received so many messages from the students, and they want me to talk about techniques of appearing in viva. I want to clarify that we are focusing only undergraduate medical students, especially undergraduate medical students of basic sites. Well, the first thing which I want to share with you is that the time has gone when viva was a very scary thing. Because the viva used to be an unstructured viva where the examiner can ask anything from everywhere and according to his or her own will, according to his or own likings. And this is why students usually could make a guess that a particular examiner will ask this thing because that is his or her favorite. But nowadays, viva is not at all a scary thing. Reason is that there's a journal instruction that viva should be a structured viva. Structured viva means that it has got minimal element of subjectivity, personal bias, or favoritism. Rather, it is designed in such a way that each and every student gets the equal chance of expressing the knowledge. Now, you must be saying that these are all ideal talks, but actually on ground level it doesn't happen. Well, I will agree to it to some extent, but we are all in an evolutionary phase and now things are actually changing very rapidly. You must have seen that University of Health Sciences have now started making structured papers. They are not usually essay type big papers which can just tests your writing skills and your composition skills. Rather, now the papers are more objective, which have got a very broad range of the contents through which the students are checked. And even if he does not perform well on one side, then he can compensate on the other side. So is the case with the vivas. Obviously, there are certain individual variations. No two human beings are same on this face of earth. Some of them are lenient, some are more straight, some have got better communication skills, some have got little less better communication skills. But apparently, and in a principle, a viva has to be a structured viva. So what I'm going to talk to you is how to prepare for the viva. Please remember that viva is not another theory checking exam. So it should not be prepared the way you prepared your theory exam. What I suggest to you is that you take each chapter and try to figure it out what is the most important point in that chapter. And that most important point, you should be able to express it. For example, if you are in a physiology exam, I'm not an expert in that, just giving you an example. If you are appearing in a physiology exam and you are studying cardiovascular system, so what do you think will be the most important thing? For me as a layman, I'm lay medical man, cardiac cycle, you should be very clear about it. Arrhythmias, you should be very clear about it. The structure and physiology of the heart muscle, you should be very clear about it. The pattern of ECGs and abnormal ECGs, you should be very careful about it. And the famous equation, cardiac output is equal to heart rate into stroke volume, and it's all ramifications that you should be very sure about it. I don't think in a viva exam, if you know all these things, they will fail you in cardiovascular system, right? So what you do, instead of having a very, very memory-based ratta wali study in which you go through the book from leaf to leaf, instead of that, just take one chapter and make a list, in your opinion, the most important point, on the chapter, and just focus on those points, and then practice it by sharing it with your friends. Viva preparation is not in a library or in a closed room where you just keep on reading. Viva preparation is actually with friends, where you chat together, you have a cup of coffee together, and you just tell your friend what you have understood about that. So this is how we have to prepare for the viva. And another thing is that during viva, There is no shame in saying that I don't know. If you don't know a thing, you, instead of just bothering yourself and entangling yourself to that point, you can simply say, sir, can we move on? It is not coming in mind right now, right? But I'm sure that if you have done such type of a structured preparation in which each chapter is studied the way I have told you, you will not have any problem in Viva. Now let me tell you something secret, and this is from the other side of the table. Good Viva examiners, let me just share with you that how they prepare to conduct the Viva. Good examiners actually, like I have advised you, they just take each chapter and from the chapter, they extract the assessment objectives. Like in cardiovascular system, the assessment objectives in the examiner's mind will be point number 1, point number 2, point number 3, point number 4, point number 5. And in his opinion or her opinion, if student knows these points, that it is good enough. And then they actually draw a line in between, which is a gray line. If student crosses that line, he's pass. But if unfortunately he's not able to cross that line, that means this chapter he has not prepared it well, or his concepts are not very well. And then they are advised to switch to another chapter and do the same exercise with that. So good examiners, they always follow a system, objective system of following the assessment objectives, and they follow it according to that. So this is a bit advice for you. You have to prepare, and I would like to share you that the medical education nowadays is working on a very, very scientific on evidence-based lines. All good institutions, they have got Department of Medical Educations, and as they are focusing on the students to prepare them well for the Viva, they are also focusing on the examiners as well. And they are also involved in faculty development program in which the examiners are also taught how to conduct the Viva according to the objective criteria which I have mentioned with you. And you will see that in a short period of time, our Viva examinations will be structured, they will be unbiased, they will be fair, they will be transparent, and they will be reproducible, and they will have a good face value. Face value means the students, when they will come out from the Viva, they will say, oh, it was a nice Viva. So as exams are coming closer, I wish you good luck, and I'm sure you'll do great in that. Thank you very much.